Hello.
And he's mine.
A big cry.
Are you enjoying yourself?
When we first discovered that Brandon had SMA, we were told that there was no treatment or cure. That was a couple of years ago. We went online, we found a lot of information, but here's the challenge, right? With so much information, we tried to then look for people in Malaysia, the doctors or the therapists or families who could guide us as to what needed to be done. Then we wanted to reach families to find out how they coped in Malaysia. And even that was really difficult. 1 to 2 babies are born with SMA every week in Malaysia. 1 in 50 people are actually carriers of the SMA gene.
We set up We Care Journey so that other families who have the same experience like us can get more support and more information on how to take care of children with SMA in Malaysia. What we want to tell other families with SMA is the journey will not be easy, there may be challenges. However, do not give up. There is hope.
It's a difficult journey, but your child also will surprise you, right? With their resilience, with their courage, with their abilities in different ways. And what it's taught us is that whilst SMA is a progressive disease, right? We don't count the days. I think what our children teach us is to make the days count.
independence. Hello, my name is Jaden, and this is my brother's story. He was diagnosed with spinal muscular atrophy when he was just 1 year old. But I don't know what that means. The doctors told my parents that he would have difficulty moving, eating, and breathing. He told my parents he would not live past 2 years old. But my parents never stopped fighting for him. My parents loved us, cared for us, and watched over us. Brandon made many friends, and I made many happy memories. Every week, one baby is born with SMA in Malaysia. We Care Journey supports families affected with SMA. Today, there are 2 drug therapies that can stop this disease. To families affected, these treatments are a second chance. I know it is hard for my family, but knowing that they are not alone means that there is hope. And while there is hope, we will keep supporting one another. I got a second chance to have a happy life.
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to all of you. Welcome to this morning's webinar, Stepping Up for SMA, which is the second in a series of webinars on spinal muscular atrophy, or SMA, co-organized by We Care Journey and the Galen Center for Health and Social Policy, with the support of Biogen, Novartis, and Roche. Ladies and gentlemen, my name is Azrul Mokkalib. I'm the head of the Galen Center for Health and Social Policy. For today's agenda, please find it on the link that is being sent to you on the chat. And you can also download the agenda, which is also going to be sent to you on the chat. As many of us here this morning are aware, August is Spinal Muscular Atrophy Awareness Month. As we've heard, according to studies, at least one child is born each week with spinal muscular atrophy in Malaysia. Around 4,000 Malaysians are estimated to be with SMA, and 700,000 are estimated to be carriers of the gene which causes this genetic disorder. Despite there currently being no cure for SMA, there are effective treatments which, when delivered early, are life changers for infants and young children, allowing them to breathe without depending on a ventilator, sitting up on their own, crawling and walking. These could potentially improve on quality of life and life expectancy. And it's possible for children with SMA today to survive long into adulthood and live healthy, fulfilling, and productive lives. Thanks to the combined voices and efforts of organizations and advocates such as We Care Journey, the strength, resilience, and courage of children, young people, and adults with SMA, there is now an opportunity to learn from the COVID-19 crisis on addressing gaps, fulfilling needs, and mobilizing the necessary resources to make the impossible possible. So we have quite a number of people that we're wanting to share with you this morning in terms of their voices. And no one could be more vocal and more passionate about this issue than our colleague here, Mr. Edmund Lim, who together with his wife So-Yi co-founded Persatuan We Care Journey after their son Brandon was diagnosed with spinal muscular atrophy in 2011. Faced with many unmet needs in care and support, We Care Journey aims to change this reality, and World We Care Journey provides support to families with SMA, creates awareness, promotes responsibility to take action, and empowers families to lead hopeful lives. Ladies and gentlemen, please, let's hear from Edmund Lim. Go ahead, Edmund.
Hi, good morning, everyone, and thanks, Astro, for the introduction. I was wondering actually, looking at the number of people who've logged on today, because it's online, we can't really meet all of you, which would be lovely if we could. But how many people, if you just put in the chat, if you look at the box, right, there's a button there called chat. Just let us know, is this the first time you're dialing in, or did you dial in last week? And actually in July also, we had a session called Get to Know SMA. And this being in a way the third, the first was something that we held ourselves. The second was something we've done with Galen, and this is the second with Galen as well. What we did was we started to introduce SMA to everybody in the first session called Get to Know SMA, where we talked a lot about the whole genetics and the whole diagnosis of this condition. Like what Azra has explained, if you think of all the muscles in our body, and if you can only control a certain small percentage of the strength of that muscle, that's essentially what SMA is. So for all of us here who are probably sitting in a chair, right, watching this webinar, if you only had 10% of strength, you wouldn't be able to do that. You wouldn't be able to sit in a chair by yourself. Actually, you might not even be able to hold your head up like what I'm doing, like what you're doing as well. And there's so many muscles involved in talking. The muscles might, because of the weakness caused by SMA, many of the SMA kids have trouble speaking clearly, and many also have trouble swallowing safely as well. So in a nutshell, if you think about SMA as all your muscles being extremely weak and getting weaker if it's not treated, that's what it is. So the very weakest would have never gotten out of bed or set up by themselves, and would have struggled to breathe, eat by themselves, from day one when they're born. So if you think about all these muscles, interestingly enough, this is a fun fact. The heart is not affected. I'm not sure medically why, but of all the muscles, the heart is actually not affected. But the muscle that is affected are the muscles that help us breathe. So in this time of COVID, we all know how distressing that can be when people struggle to catch a breath, and what that can lead to. Obviously very disastrous end results, right? Because it actually does cause the end of life, and that's a fear and that's a nightmare that all of us families for SMA have been living with from day one. And we get it not from COVID. From day one, we've been worried about just the common cold, common flu, because things like that have led many, if not all the patients, countless number of times into hospital, struggling to survive, because before long, if your breathing is weak, that means you can't cough well, you can't cough strongly, which means you can't get rid of the secretion that's in your lungs, which leads to pneumonia. And pneumonia, if not treated well, and because it gets worse, because the breathing is weak, the cough is weak, it ends up being the highest cause of death, for patients with SMA. So that's why today we've got an expert, Dr. Ek, who's going to share about respiratory care for patients with SMA. Some of the things I think that she's going to share, I think you're going to find interesting as well, because in these current times, there's something that that clouds over all of us, this whole concern with catching a virus and having respiratory issues. Now, following on from that as well, because all the muscles of an SMA patient are weak, there's a lot of things that they can't do well at all, right? Think about just sitting up and watching a webinar. That's when rehabilitation becomes critically important. Critically important because, we have to maintain, or they have to maintain, the best ability that they can at any point in time. And that takes a lot of rehabilitation skills to be able to work well with a patient to keep doing this. And it's lifelong. So that also poses another challenge. Now, because I think you can imagine how burdensome and how difficult it is living with SMA, not just for the patient, but for all the caregivers. So one reason why we're having this series of knowledge sharing is to make sure that, Azra mentioned this now, there are probably about 7,000 people who are carriers of the SMA gene. As carriers of the SMA gene, you carry no symptoms, so you don't know. But what happens is when two carriers plan to have a family, there's a risk that the child that they're going to have will be born and affected by SMA. So that's why we think, through education series like this, it's really important for everyone to know, not just medical professionals, but the general public, and for you to share also with your friends, family, associates about SMA. Because the more we know, the more we're all able to play some role in helping to prevent to helping to diagnose early, and helping to lead people to the treatments that they need in order to ensure that they've got the best optimal outcomes in their life. So I really thank all of you. Sorry, before that, if you think about 7,000, right? I heard on BFM radio just not long ago, what that looks like. If you think about a classroom at a government school, there's about 40, 50 students. That's like every classroom has one person who's a carrier, from our generation, generations before, generations after. So contextually, you think about that, that's the carrier rate of SMA, and how actually more prevalent it is than we believe, than we usually believe. So I'm not going to take up too much more time. I'm going to end now. I thank you all for being here, because I think we all play some small role for ourselves and for the community, for others, in being more knowledgeable about SMA. I'm going to pass it back to Azrul. I thank you all for making your time on this Saturday, and I look forward to the Q&A sessions later on. Thank you. See you soon.
Thank you, Edmund. Thank you so much. And again, I am reminded of how compassionate, passionate, and committed that people like Edmund and those in the SMA community are, who are really inspiring examples for all of us. I also wanted to just remind everyone who's participating this morning to please send your questions through the Q&A box at the bottom of your screen on the Zoom channel there. And I know there will be lots and lots of questions in the next sessions ahead. So please do not hesitate to send your questions through the Q&A box, which is at the bottom of your screen there. So we now go to our first speaker for this morning, and definitely we are going to be hearing quite a bit about our understanding concerning SMA, and we have with us Dr. Peng, who is a consultant pediatrician and pediatric pulmonologist at University of Malaya Medical Center. She was trained both in Malaysia and abroad in pediatrics and pediatric respiratory, as well as sleep medicine. Throughout her career, she's published an exhaustive list of research papers in her area of expertise and is affiliated with numerous respiratory medicine societies and organizations. So let's hear it from Dr. Peng.
Good morning, everyone. I'm Dr. Ik from UMMC. Today, I would like to share with you on how children with spinal muscular atrophy breathe differently and how do we take care of their breathing. As we all know, children with SMA have generalized muscle weakness, including muscles that are used for breathing. Breathing failure is often the main reason for severe SMA to have a shorter lifespan. In a person with normal breathing, ribs move up and out, diaphragm flattens when air flows in. When air flows out, ribs move down and in, and diaphragm relaxes and moves up. However, in children with SMA type 1, they have very weak rib muscles and underdeveloped lungs. The diaphragm is relatively stronger and it is the main muscle for breathing. So you will see an unusual breathing pattern, what we call a paradoxical breathing, in which the child's tummy moves up when breathing in, but the chest stays down. Because of the lack of opposition muscles against the diaphragm, the chest wall in children with SMA often appears collapsed and bell-shaped and sunken. The weak muscles also make their cough weak and ineffective, resulting in poor airway secretion clearance. This increases their risk of getting chest infections. Other than that, they can also have shallow breathing, what we call hypoventilation, usually start off during sleep when their muscles are more relaxed. Hypoventilation is often the first sign of breathing difficulty in SMA. Previously, the severe type 1 SMA usually pass away before 2 years of age due to the progressive muscle weakness. They often start off with respiratory muscle weakness, followed by swallowing difficulty, and then having issue with breathing during sleep, and lastly, ventilatory failure during the day and the night. But now with the new disease-modifying agents, gene therapies, and the advancements in the medical technologies, there's hope for these children to live longer and to have a better quality of life. What are the respiratory care that we can offer to these children with SMA? First, their breathing needs to be assessed regularly. We can monitor the oxygen level at night by doing an overnight pulse oximetry to check whether there's any hypoventilations, evident by lower oxygen level. Next, airway secretion clearance is very important so that to prevent infection. Children with severe breathing difficulty may need to have respiratory support with machine, either invasive through tracheostomy or non-invasive through a nasal mask. Besides the routine care, we also should need to take care of their breathing when they are down with infection or an upper or lower respiratory tract infections. To clear the airway secretion, we can use a machine to assist cough and manual or mechanical technique to mobilize the sputum. What are the benefits of NIV or BiPAP? It can help to relieve the breathing difficulties by resting the respiratory muscle to let them recover and decrease the respiratory symptoms. It can also improve the lung compliance and ventilation, prevent lung collapse. It also improves the sleep quality by correct the hypoventilation and improve central respiratory response to carbon dioxide. When do we start an IV? There's no standard guidelines. It can be after recurrent chest infections, presence of hypoventilations, daytime hypercapnia, or sleep disturbance, either due to frequent arousals or poor sleep quality. Next, I would like to share some tips on how to manage breathing problems in children with SMA. Parents or caretakers need to learn chest physiotherapy, percussions or postural drainage depending on the needs, and learn how to do suction to clear the airway secretion. If breathing support is needed, discussion on the options with the medical team should be carried out, and work with the medical team to develop care plan to prevent problems and also a plan for use during acute respiratory illness. Most importantly, to prevent the child from chest infection, because this will make the child's breathing worse. Practicing the 3W and avoiding the 3C for protection of COVID infection is definitely also helpful to prevent infection by other respiratory pathogens as well. Make sure everyone washes their hands before touching your child. Keep your child away from anyone who has a cold, fever, cough, or runny nose. Keep your child away from crowded areas. Keep your child away from tobacco smokes because it will increase the risk of getting chest infection. Also restrict your child's exposure to other groups of children or people. Immunization is another preventive measure, so not to forget immunize your child and siblings against influenza. And now with the pandemic, we also have COVID vaccine. So the caretakers and whoever in the families are eligible for the vaccination are recommended to get themselves vaccinated. Meanwhile, the caretakers should continue the routine respiratory care and seek medical help early when the child becomes unwell. This is the end of my talk. Everyone stay safe. Thank you.
Thank you so much, Dr. Egg. And definitely there were some questions there that I'm sure some of you already started to think about concerning her presentation. And we will now go to our next speaker. And before that, allow me to just remind you again that you can ask your questions through the Slido application as well as through the Q&A feature that is at the bottom of your screen. Please do make use of that to ask your questions. Do not use the chat. Send your questions through the Q&A feature on your Zoom. So for our next speaker, we have with us to speak about why rehab is important for SMA. We have Datin Paduka, Dr. Tunku Taayah, Tunku Zubir, who is a consultant rehabilitation physician with Gleneagles Hospital, Kuala Lumpur, and Ramsay Sime Darby Healthcare. Trained in Malaysia and the United Kingdom, her area of expertise includes rehabilitation medicine with spinal cord injury, brain injury, and pediatrics. With that, over to you, Dr. Taayah.
Right. Mute.
We can hear you, Doctor.
Okay, you can hear me?
I can hear you.
Okay. A child is like a butterfly in the wind. Some can fly higher than others, but each one fly the best it can. Why compare one against the other? Each one is different, each one is special, each one is beautiful. Assalamualaikum and good morning to ladies and gentlemen. And thank you, Azrul, for the kind introduction. And today, there's no disclosure on my part, but what I would like to share, can change the next slide, please, Azrul? Okay, what I'd like to share today is on why rehabilitation is important for spinal muscular atrophy patient. And my talk, I will cover on first on the principle of rehab, and then I will go on a bird's eye view on what are the rehabilitation strategies. All right, when we look at rehabilitation, a lot of time we think as rehab as just physiotherapy or exercise. But when we see rehab, it means a process of helping a person to reach the fullest physical, psychological, their social, their vocational, their avocational in terms of their work, education, hobbies, work and education potential consistent with their physiological or anatomic impairment, the environmental limitation that they have, their desire and life plans. Next, please. And when we say desire and life plan is patient desire and life plans, not the doctors, not the therapists. Okay. And next, please. Wait. Okay. As for myself, whenever I see a patient, and I always remind my my team members that when we look at any child, especially any patient with especially with spinal muscular atrophy, we are obliged to consider more than the disease organ, more even than the whole man. We must view the man in his world, meaning that, example, a child, a girl with type 2 muscular atrophy who have weakness, who has difficulty in using his upper limb, who have groups of friends that she likes to connect and play, who loves loves computer and loves to watch sports, and who has who's looked after by single parents. The environment is not that accessible. So we need to address all this issue if we want to assist the patient to get to the best possible level. So this is a reminder that all of us who work with spinal muscular atrophy patient to view the child, the patient in their world. Next, please. Okay, this we know the spectrum in spinal muscular atrophy. The problem they have is not just weakness. Okay, they may have weakness more of the proximal of compared to the distal. They may have problem with their chest, as what Dr. Peng mentioned, and they may have problem with fatigue, tiredness. They may have scoliosis. They may have even swallowing problem. They may have even difficulty in open their mouth, and the social issue, the issue that they may have. So it's encompass all the system. And as such, next please. So this spectrum of disease is with multiple organ involvement mandates a multi and interdisciplinary team effort for us to have an effective care. And of course, the most important person is the patient and the family. Yeah, and gone are the days, and gone are the days where the doctors make all the decisions. Okay, you do this, do that. Now we need to involve the parents together with the whole team, addressing what are the patient concerns, what are the goals, what are the plan for the patient together to assist them. Next, please. And okay, I think without doubt, to know whether the success of early intervention and quality of life first is the early intervention. Now, with this, disease-modifying treatment, with the gene therapy, this is very important. It makes a lot of difference. Early identification and early access to intervention and rehab. Family involvement, I think whoever have worked with children or anyone with spinal muscular atrophy will swear by that family involvement is crucial. It makes a difference. So it's very important. And of course, having a qualified professional who have experience. But like I say, all of us, we need to empower ourselves all day. There's so much new things happening. So doctors, therapists, families, we need to always update ourselves. And of course, integrating into the community. Next, please. Like I would say early detection, access to early intervention is critical. Next. Okay, when we look at rehab strategies with the current advancement in the medical treatment and all that, so there is created a paradigm shift in rehab and treatment of spinal muscular atrophy. But the principle of rehab remain the same. Okay, we need to look at all these aspects, which I will go in bird's eye view later. But what I like to tackle here is the carer support. This is sometimes neglected, and we know, I think enough studies show that parents or family with spinal muscular atrophy, they encounter high degree of strain and stress, especially when they've been diagnosed early on, and because of the severity of the disease, poor support. So of course, everyone have their own unique experience, but mainly they will have expressed their shock, their anticipating grief, helplessness, and the fear of the unknown, other losses. So we need to look at the psychosocial support from the time of diagnosis and continual support. So I think now we are fortunate, we have quite a good support from the family support system and a family support group like We Care Journey, the Spinal SMA Association, and all that. And patient may need also support with counseling, psychological support. So parents who need help, please ask for the help. Next, please. All right. What I would like to say about the rehab now, I think important for us clinicians and for parents also to understand that we need to do an objective assessment. It's a comprehensive and objective assessment. I would say functional assessment is critical because before we commence. There's no point starting rehab program but without a good assessment. And now there are many assessments that is specific for spinal muscular atrophy. But we have Hammersmith Function Motor Scale. Now we will have a revised Hammersmith scale, and there's also EK scale. There are many, and depending on the types of the patient, whether the patient is non-seater, seater, or walker, these are the functional classification, the type of the patient disease, and also the natural progression of the SMA. So the principle is still the same, but we need to make sure that we try our best to prevent complication, improve the function, maintain what is there, and to compensate if there's any need. Next, please. And physiotherapy, I think, of course, physiotherapy, it is very, very important, like what Dr. Peng mentioned in terms of the chest, to make sure that, patients are stable, minimize the frequent infection, but at the same time, preventing contractures, preventing tightness, improve the functional control, improve the ability, trunk ability, positioning. At the same time, we look at, make sure we monitor the fatigue, pain level, and to avoid overuse of the weakness of the muscle. So there are many techniques that are being used by therapy. So all these are guided. There is no secret recipe. So every patient will be based on their assessment. Next, please. Yeah, what I would like to mention here is just that a lot of time patient, it's not just a therapist. The family, they need to learn the right techniques. It's not enough coming for therapy 1 or 2 times a week. They need to do it every day. So parents need to be taught on the right technique for handling the patient, your child, how to play with them, how to interact with them. So I think I really applaud WeCare Journey and also some of the therapists who have started this like a hybrid. So they have a physical first assessment, and then they have a contact, and at the same time they do tele-video. And that I find helps a lot. Parents are more involved, and of course in the COVID situation now, this is, our parents, our patients are being given the continuous treatment even in view of the current situation. Next, please. And of course, this is very important. What I like to stress is the posture control. The patient sitting, you make sure the right way of sitting, control supported to prevent problems, and of course standing. I think we need to stress upon parents, encourage standing as much as possible in the day, because it makes a lot of difference. The child will be prevent contract, tightness. They may be able to improve circulation. Their breathing are better, and the best level, they are at the same level of their friends and family. All right, next, please. Okay, for children or for walker, so these are the things that we need to also address, because there are patients that we need to also look at their gait pattern, their energy level, whether they need walking aids, they need any orthosis, and then quite a number of patients, they may be able to walk, but their energy is a lot. So they may need to be combined with wheelchair. So some patient, some children or patient, we will say that, okay, they may walk indoor or maybe at the therapy session, or they can walk with walking aids, but when they go outdoor or long distance, they may need the use of wheelchair. And of course, there's some patients that I see adult, very rare, the type 4, when they come with just some simple, with just a minimal weakness, they may need some assisted with orthosis or gait. Next, please. Okay, occupational therapy also is very important because a lot of our children, so we need to encourage hand activities. So activities, if they can put on your own dress as much as you can, simple thing as SPD, the eye-hand coordination, all this we need to look at. Next, please. And if they are not able to, there's so many assistive devices. Some parents are creative. They can do just simple thing to assist the child in being more independent. But of course, the other thing that we need to address is especially when they are in activities, when they go to school or, when they go to work, at home, their energy, we need to teach them the energy conservation technique so that they don't be fatigued, and also to pace the activity well, and some modification, simple thing that we can do in the environment to assist them in their daily care. Okay, next, please. What I like to remind here, because most of our children are bright, they have no problems with their intellectual, but we need to stimulate their other senses, which is their tactile, their vestibular, their proprioception, their oromotor, their visual auditory. We see that when we challenge and we incorporate that in activities, their progress are also much, much better. Next, please. So in the occupational therapy, they will also do sensory integration, improve on especially their proprioception in terms of activities, playing next with the ball, vestibular, next playing with the sand, building sandcastle, and also interacting, weight bearing. All these play a significant role in getting them to the best that they can. Next, please. All right, the other area that we need to look at the speech and language therapy. So some of our patients may have problem with feeding. They may have problem with swallowing even, and that also will cause problem with their respiratory. So speech therapy, we need to get them early. So there is some compensatory strategies in terms of posture, chin tuck, and all that to assist the child. Of course, we can see a patient when they're not eating properly, something they take so long to eat, and of course, and when they're fatigued, it may go to the lungs, and this can cause significant problem to the child. So a good eating, we don't want them to also overeat, because sometimes as we see children, they are in the teenager, they may put on weight, which is more difficult for them to be independent. And if they have problem eating, usually we may even need to resort to nasogastric tube or even PEG. The other thing that we need to look, most of our children, they can vocalize, but of course in the severe type, they may not have a poor voice control, or they may not be able to, maybe, then we need to consider what we call alternative augmentative alternation communication system, like AAC, the few different level from low tech to high tech. The speech therapy will be able to assist you on that. Next, please. Okay, autosis. Okay, there are many. What I like to stress on autosis, we use it to prevent muscle contractures. And it is very important to choose the right one. Assessment, it must be custom made and must be assessed by the team. A wrong autosis may make more a problem, because pressure, discomfort. So these are things. Next, please. The other area that we need to be aware, there is a lot of problem in our patient, especially when they are sitter, they're non-sitter or sitter, but even then a walker also may also have problem with scoliosis. So most of the time they have C-curve, and they also associated with kyphosis, pelvic obliquity. The management also is not easy. I think this is a time when we as a team really need to discuss it together with the surgeon, with the orthotist, with the therapist and the parents, because we have to weigh, is it appropriate, a patient really need external bracing, do they need surgery, whether what are the benefits, what are the disadvantages, and of course some patients who are very severe scoliosis with bracing and surgery is not a treatment that we can, because of multiple medical condition and the condition of the child. We may adapt. We may need to just consider a customized adapting system support with a 2-point, a 3-point system support to assist them in their posture, and that may be the best for the child. All right, I would like to mention about wheelchair. The thing about wheelchair is we need to assess the child to get the right wheelchair, not just give any wheelchair, put the child in. There's so many different types. And I think a good wheelchair is like good pair of legs. It makes a difference to their mobility. You can see they are independent. Look at Brandon, he's so happy, can help, so rajin helping the mother. So it's like, wow, maybe like on your words, we can see. So a right wheelchair is important, and you need assessment. Okay, all right, next please. Okay, the other method, we do is hippotherapy, hydrotherapy, all available. There's so many centers that have it now. Next, please. And of course, in hydrotherapy, so children love water. So there are many, they love water. They respond better when they go for hydrotherapy. They'll be looking forward to it. And there are many different techniques. I think therapists now, they are trained. They are with the water, the buoyancy, all that is very helpful. Next, please. Okay. Are we okay? The next slide, please. Okay. Okay. Robotic technology. So now I think everybody's talking about it. So it's rapidly growing for the last few years, and this is something we can consider for our patient, but it's complement together with our therapies. Next, please. Okay. Next. Okay, of course, we need to look into independence in the community. For our children, our patient who may want to drive, there is modification in the in the car that we may need to address, and of course, home modification like ramps. Next, please. Even a lift or stair lift, and even a simple modification in the bathroom, all that will make the quality of life better for our patient. Next, please. Are you okay? All right. So basically, this is my last slide. It's very important for all of us work together. I mean, they say it takes a village for any child, and we need the whole community or the whole country make sure they have the best medical early diagnosis, early medical intervention, early comprehensive rehabilitation, looking into the academic, when they need to go back to work. Government also have to enforce the policy, and make, enforcement must be better. The individual themselves, make sure you empower yourself in knowledge, the individual and the family, make sure you're fit to the best that you can, get the psychological support, the environment, make sure it's accessible, and of course the community accepting. And I think if you work together, inshallah, we can ensure that any children, children with spinal muscular atrophy and the family gets the best support and get the best care. Thank you. All right. Thank you very much.
Thank you so much, Dr. Taayah, and thank you for such an interesting session just now. And definitely some of those videos are definitely we're going to be looking at and being inspired by. If I may ask, before we continue on for the next session, that all the speakers and Edmund and Soyi, perhaps we could just switch on your videos and we'll just do a quick snapshot for prosperity for photo. Okay, excellent. Thank you very much. So we are coming to the discussion part of the session, but before we start, I thought we'd have a nice sort of poll to launch to see how much unhealthy food are we eating these days. So yang mana lebih best? Please vote. Nasi lemak dengan rendang ayam or bihun goreng sambal petai.
How do you do that? Oh.
Okay.
I don't touch her.
I know, right, Doctor?
I saja ini the whole thing which one nasi lemak lah dan ayam.
I'm told that bihun goreng sambal petai is hard to find, but it's very, very yummy. So.
I cannot understand. Oh, okay. Yeah. Panelists cannot pay.
Okay. So only 38 people were able to vote. So we'll have a look there and see what Adlina has just labeled as guilty pleasures. I'm now hungry. So thank you very much for this poll question. Okay. So we have with us 73% nasi lemak dengan rendang ayam and 28% with bihun goreng sambal petai. If you can get some petai, please share. Okay, so we go to our next segment. If I could ask Dr. Egg if your camera is able to be switched on. So we have quite a few questions that have been raised and we should be able to get them answered in this session. Dr. Egg, are you there? Okay, while we're waiting for Dr. Egg to come on, perhaps we can go into some of the questions already. Dr. Taayah, we have here quite a number of questions concerning COVID, but I'll go to the questions for you first. And the first one is, what tips for patient and caregiver do you have to make it more effective in terms of getting results? Because there's so many therapists and doctors involved. What kind of tips and advice can you give patient and caregivers?
Okay. I think first, understanding about your child. Okay, what is the natural progression of the disease? What are the medical, current medical, current potential function that the child may have? And then I think the first, I say, when we know a baseline assessment, the assessment being done, so you insist on the assessment because it will tell, it's very clear. Then you can see, what are the next step you can do? Because from the assessment, we can use the assessment as a guide for the therapist. So I think first, get to, for a doctor, I mean, it'd be ideal if we have the whole team in the same, building, the same setup. So everybody talk the same language. I think a lot of parents pening and kepala is because the therapist is somewhere there, the doctors is there, and then, and everybody don't talk to in the same language. So I think first understand about the disease because every child differ. Like I say, it's a multi-organ, a presentation, and of course now with the treatment that is available, so that also make a different change. What I can say that what I see patient now compared to when I see 20, 30 years ago, the presentation can be different. Which is great, to a certain extent. So I think first empower yourself with knowledge and what can be done, and then get yourself. I think parent support is very important, crucial. I think I really salute, Edmund, Zoe, and all the other parents who are really go all out. It makes a lot of difference. But sometimes being in a group, they can help each other better. Like for me, I learned a lot from my patient and the group. As professional, we are like, there's so many on our, all these different things in our plate, the diseases, but the parents learn from each other, but of course guided by your medical and rehab staff. And then, I think that
Dr. Taayah, that's really important points there in terms of how we can actually look towards providing care and support for a SMA patient, and that is to continuously be learning, keeping up with developments, and most importantly, I'm sure most caregivers and parents are out there doing this, is to also consult the medical team. And we talk about it takes a village, right, to raise a child. It really does take a team to provide the kind of support necessary for a SMA child. So I want to go to Dr. Edgar, who's with us. We have quite a number of anxious and concerned parents right now, Dr. Egg, and that is regards to COVID-19. So the question here is, if a SMA patient gets COVID-19 and starts to have respiratory issues, what do we need to do? Go ahead, Dr.
Questions. Okay, now talking about COVID-19 is like either you're having illness or not having illness, so there's chance of getting COVID-19. I think first thing is actually not to panic and seek for help, seek for the correct help. I mean, if under a doctor, whatever team follow up, then just get advice to doctor what to do, because not everyone, like for now, because even though we say those with chronic underlying illness may get more likely to get severe illness, but that's in adults. In children, we don't really have enough data to talk about that. But we generally also think that anyone with respiratory problem, when they get a potential virus that potentially attack the lungs, we definitely will be more careful. But whether actually this ones need immediately to be brought into hospital or can be monitored as outpatient at home, I think this depends on individuals and how likely that you're able to be monitored from distantly from your doctor, or else actually probably it's better to get warded. So I would say it's actually, for now, even KKM guideline is actually really depends on individual rather than say fix a blanket rule that everyone need to be warded.
Thank you, Dr. Egg. And I think the important point there really is it's necessary to bring them to a medical practitioner for advice and consultation as soon as possible.
Yes.
So
there's many ways to do it. Either actually you call, because there are hotline, or even your own personal doctor, if you can just call them directly, contact before actually we act what to do, because sometimes we just got rushed and then rush to nearer hospital, but then because there's no pre-arrangements done, then they may not be able to get to the medical treatment rightly.
Okay, thank you, Dr. Egg. Dr. Taayah, I think this question is for you. Is a CPAP machine suitable for SMA patients, especially for infants? Is it recommended for SMA to use CPAP instead of BPAP machine? What is the difference between both machines?
To Dr. Eng, right? This question, yeah. It's not to Dr. Eng.
To you, Dr. Taayah.
I think Dr. Eng will be better to answer this question because CPAP and this is under
respiratory. Yes.
Okay, Dr. Egg, go ahead.
CPAP is continuous positive airway pressure. So it mainly provides some peak, what we call peak end respiratory pressure to stand the airway, to prevent the airway to becoming collapsed. So it mainly used in case like obstructive sleep apnea, when we the airway collapse during sleep, then we want to stand the airway. Then BiPAP, bi-level, is basically not just about the support to prevent the lung getting collapsed, but they also actually try to help give certain pressure on during inspiration to help to make the lungs remain expanded to a certain level. So it's bi-level support during inspiration and during expiration as well. Those children with neuromuscular diseases, hyperventilation, there are problems with ventilation, get the air in and get the air out. So bi-level is the more suitable mode. But having said that, we do have some children with neuromuscular diseases, so they can have just start out with obstructive sleep apnea first. So really depends on the indication, but majority, those with weak muscle, they usually will need a bi-level support.
Thank you, Dr. Egg. So that's quite important to understand the difference and the role those machines play within the support for SMA patients. Thank you very much for sharing.
The other thing also, the cost-wise also a lot different. CPAP is a few thousand, BiPAP is usually over 10K. Okay. Because it's actually higher end of support.
Thank you. Dr. Taayah, I have a question here. And this is concerning therapy. There's a lot of talk about physiotherapy, and sometimes we get OTs to come to the house. This is before the COVID restrictions were put down. There's been a lot of parents, a lot of individuals who are looking for different kinds of therapy, including hydrotherapy. So the question here is very important for especially newly diagnosed cases and for parents and caregivers. Is it affordable that what we have here in Malaysia when it comes to the necessary therapy? And is it possible to learn these techniques which can be done at home with the person with SMA? Go ahead, Doctor.
Okay, yeah. I think I say the therapy will depends on individual, and of course, whether affordable. Okay, to me now there is there is many center, government and private, and NGO provide some form of therapy to a child with SMA. But I think when they are fully diagnosed, I mean most of them will diagnose in a hospital, tertiary hospital, who have all the support, get all the information, learn all the important, the assessment, learn the important points within from the team, and then of course, okay, a lot of time when they do therapy, you don't need that. Of course, the frequency, the intensity make a difference. Of course, the more you do, the correct approach, all make a difference, and of course, depending on the child's condition type. But a lot of time the parents need to be involved. To me, because when we teach the parents will be able to learn the right technique, and then and parents can carry it out, every day throughout, not just do it as a therapy, but in terms of daily function, when they are with the family, when they are eating, when they're doing things. So learning, the parents carer training, it is, I would say, mandatory, like there's such a word, because it makes a difference. The carer, like the parents cannot help, get the other involvement, the maid or even the grandparents can help in doing it. Okay, I think now, affordability, to the question, like say now government hospital they have, so of course as long as you are registered, in you have a welfare card, so most of the treatment are relatively, treatment therapy or that relatively free. Of course, to get the session may be a bit difficult compared to in a private hospital. Private they have more available session they can provide. But the other thing that now, which I find is very interesting now, which I think the COVID makes a look into a different perspective, because like I said earlier, the We Care Journey with a few therapists has set up this, even before the COVID, I think within last year or 2 years, they were setting up. So it was a hybrid. So the assessment done physically. So the parents who know the therapists who know the child do a good assessment, really they do Hammersmith or whatever, indicated assessment, and then show the parents, and then the parents will do it at home, and they have a teleconference video every once a week, and the therapists, will guide the parents. Of course, some parents, they're very, some parents are very good, they learn by themselves, but I think all the time you must be guided by the therapist, by the rehab team, because sometimes, they are expert, or therapists, occupational therapists, this is their expertise. So you need the guidance by them, because sometimes the parents may be doing the same thing for years and years on when the child differ. So I think like the hybrid is one of the way with the COVID situation now, and with affordability issue, transport issue, the accessibility. I think the hybrid, I don't know whether it's called a hybrid form of therapy, is one way to address this issue. Yeah.
And another question for you, Dr. Taayah, is what's your experience in putting SME type 2 with TLSO, which is, I think, thoracolumbar sacral orthosis? I find that children do not like to wear it many hours. It's hot and uncomfortable. Any tips that I can use to advise my rehab colleagues?
Yeah, I think this is the challenge. I think for the last, it's always like when we see a patient with scoliosis, and I will get the orthopedic in, we discuss with therapists as a team, because this is not an easy. And I get the orthotist also, and I'll get a CPO that I trust and a good one that I can, we work together. In this type of cases, when there is scoliosis, you can never work alone. You need the whole team, because there are many issues. TLSO itself is not the answer. A lot of patients cannot tolerate, because one, let's say it's hot, but of course that is not the main issue. The main issue is compromise to their respiratory and also their skin. And most of them maybe, when they are young, they're a bit their skin a bit more easily, get pressure. So that's an issue. And then to get the correction, like I say, you need to wear it at a certain, certain duration. And for the compliance lagi, and it's expensive. If you buy and they don't use compliant it's like a waste, And so to me, first, a good assessment, what are the steps they need to improve the posture? Scoliosis. Of course, the scoliosis is also degrading. We need to see, there is guide that we use, below 20, what we do, when 40, what are the step by step. But sometimes even we follow the guide in spinal muscular atrophy, we cannot even do it because of the medical condition and all that. So to me, I will do a good assessment whether do the patient really need a TLSO, or they can just, because of the medical condition pressure, maybe a customized sitting. Actually, sometimes we may think that customized sitting, if you really have a good technician or engineer or wheelchair can help you, you can really correct to a certain extent, but it's not really to correct, but accommodate, to prevent. That can be helpful. But the other thing, the CPO is very important. The fitting of the thoracolumbar, because I cannot get just any CPO around to do it. I must get the one that I trust, and we must monitor closely. That's the thing. We cannot just give it and bye-bye. You need to monitor, get them to see how's the follow-up, and you may regular review yearly, to see the X-ray and all that. But regular review to make sure how the child compliance and any problems associated with the TLSO. Yeah. So it is not an easy decision to make.
Thank you, Dr. Taayah. Dr. Egg, we have a question here concerning sleep study. My child has missed sleep study last year because we were worried of the risk of COVID in the hospital. What's the situation like now? Is it any better? Is it safe to do sleep study now? And also, I'm going to give you another question, which is sort of in the same line. Is is that there's a lot of stories concerning there being no beds in hospital. So what can a family with SMA do in that kind of situation? Go ahead, Dr. Egg. 2 questions.
Okay, thank you. The story of no bed is actually true, especially in most government hospitals, especially in adults, those who need ICU or severe COVID. Yep. But there are some private hospitals, they also treat COVID patients, especially the milder one. And this COVID beds is very dynamic. You do not have bed today doesn't mean that you may not make one bed tomorrow. So I would say if anyone who really need a bed, then should come to a hospital. The doctors, I mean, everyone, I think any healthcare workers, they will try their best to, if you really need a bed, they would not, they will try to make beds for you. Then the other one is about sleep study. It depends on actually what's the indication, what's the urgency. I would say probably there's no place, I mean, now in Klang, maybe there's no place is safe for anyone, even children. Even you're talking about at home, you keep a child at home, also they got COVID from adults. You send to the babysitter, they got from babysitter. So I would say there's no one so-called 100% safe place. It's about the SOP. I think everyone know, even you have to follow all the SOP vaccination that will make our environment, will make the conditions safer. So even sleep lab also, they follow SOP, they go through screening first. And not just talking about even whether the technician or the nurses or the doctor, are they, I mean, they have whether it is carry a lot of virus there, but what about ourselves? Are we actually safe to the counterpart, the one who do the sleep study for you? So are you safe enough for the technician to do? So both sides is actually, there's always risk that you don't know. If we do not tell that we are unwell and then we still come. So I think the point is everyone need to know what's the risk and what's the benefits and weigh the both, see which one is more important. If the medical condition that make you need an urgent sleep test, and with the strictly follow the SOP, yes, this can be done. It shouldn't be a problem. But you think it's actually the condition is something can wait. You want to wait until this endemic a bit more settled, then of course it can postpone and get to another date.
Well, thank you, Dr. Egg. I'm sure there's a lot of anxious individuals out there who are looking at the current COVID-19 situation and trying to decide even whether or not to go for therapy or even a consultation at the hospital, not knowing whether or not it's possible to do.
Yes, very true.
I have a question here again, Dr. Egg. Both of you are equally famous, Dr. Taayah and Dr. Egg, so don't worry, a lot of questions coming.
Oh, no.
So the question I have here for Dr. Egg is, how do I know whether my son is suitable for using BPAP or CPAP? For your information, my son is diagnosed with SMA 1.
Usually anyone diagnosed with SMA type 1 in hospital, like our hospital, they usually will get a referral to respiratory physician for their primary or respiratory status assessment. So from there, as I mentioned, there are, of course, we need to see the child, how from the history, any previous respiratory symptoms. If none, we also sometimes at least look at how they breathe physically. Do they have this abnormal chest wall that I mentioned, like sunken chest and paradoxical breathing? Then even though they are so-called asymptomatic, no respiratory symptoms, no cough, but they probably already had some degree of hyperventilation or whatever. So sometimes the minimum that we do, instead of full sleep study, full complete sleep study, we do a overnight pulse oximetry to see the oxygen level. If it's normal, then at least we know okay. So mainly it's like every review, every time they come to see us, we probably have to assess what is the latest respiratory status. And often when they get an infection, their respiratory status will deteriorate, but can they gain back to their baseline? Depends how severe the lung get injured. So the best is still to avoid getting a lung infection, because you will never know if you're hit by one bad virus, then it probably that's it. So sometimes even though we say often it's recurrent chest infection make you ended up had to be on BiPAP, but sometimes even one severe infection that caused that we couldn't wean off the support, the BiPAP support. If we need to try on machine, we usually try them in the hospital so that we know what is the pressure suitable, what kind of machine that's suitable. Are they comfortable using with the mask? So a lot of the interface, the machine, the setting, and after using that, do they get better? What's the outcome? And then what is the compliance issue? I think a lot of things, it's before we put on machine to a child with SMA, we always discuss with the parent first, right? Whether how do they take this machine, because it's not short term and they have to learn how to handle the machine.
Okay, thank you, Dr. Again. And patient carrier education, actually, in that sense, is very, very vital to ensure that the optimum care is able to be provided. So even if you do have the medical device, if you don't know how to use it properly, then you could
even you know how to use it, you don't want to use it, it will just put aside. Yeah.
So Dr. Taayah, we have a question here. Well, you get a question all the way from Bhutan. And I would like to just say this is impressive for us to have people from so far away participating and following this. And apologies for waiting so long. I am Ugyan from Bhutan. My daughter is 13 years old, SMA type 2, and has developed scoliosis at 60 plus degrees. We use the TLSO brace. Are there any spinal exercises which focuses on improving the scoliosis? We have a lack of therapists to manage the case, and I follow the scoliosis exercises from the internet, but all are on the patients who can walk. That's what's available on the net. So it refers to those who can walk. So some recommendations from you, Doctor, for any spinal exercises for SMA children who are wheelchair bound.
Sorry, wheelchair bound or he's walking? I thought
wheelchair bound.
Wheelchair bound. So the exercise is more for walking, wheelchair bound. Okay, thank you very much for the question. Yeah, I think 13-year-old girl with type 2. Okay, the degree is I think okay. One, we need to look at, I think it's difficult for us to just say what are the exercise to do, because we need to see the child overall, because we need to look at the respiratory, and also the muscle, what are the muscle that is weak. Of course, we know most patients in type 2, the proximal are weaker than the, weaker than the distal, but we need to see what are the muscles, sometimes tricep or, and also the core stabilizer, what are the weak muscle. But you say that the degree is 60 degrees. And of course, in the wheelchair, the exercises are a bit different, and somebody who is walking. But the thing is, the exercise, basically, we need to look at a few things. One is where is the tightness? We need to look, there may be some stretching exercises, but the stretching exercises, so there are many different, depending on the patient's condition. So I think the stretching you need to do, and then whether we can, because when you want on the TLSO, you are not, there's not much exercise you can do for the core when you are on TLSO. So I'm not sure how long your daughter can use the TLSO, but usually we encourage to use it, when you're sitting. I think usually if non-scoliosis, we ask them to wait 21 or 22 hours per day. But in scoliosis, in spinal muscular atrophy, we have to weigh the balance, so we will advise and we monitor the child. But the exercise, I think in Bhutan, I know there may not be that, I don't know, you say there's available of a therapist per se, but I feel that at least for one session for the therapist to have a hands-on on where is the tightness actually of the muscle, what group of the muscle are tight, and how are the sitting posture, and what are the respiratory condition like, and then we can tailor it, from then on. But I feel that like just now, as you say, whether somebody has mentioned now with this, doing tele video, whether it's something that we can even show. So maybe I think it's a bit difficult for me to exactly tell what are the therapies that can be helped. But basically, it encompasses the posture, the stretching of the muscle, the strengthening, and whether we can work on some of the core stabilize strength, core stabilizer exercises a bit when without the TLSO. So maybe I think we can organize, and we get like maybe a tele video or something, but it may not be pertaining to her, but at least to give a bit more idea. I'm not sure whether there's any current videos that specific for not wheelchair bound scoliosis. But I think the other thing that mentioned is when the child or any teenager or anyone in a wheelchair, the exercise that we can do are slightly limited. So I think beside the scoliosis, we have like a scoliosis exercise program. So that is that we need to teach the parents and need to be done. But at the same time, the child may need all the other exercise also. So mainly when you're in a wheelchair, even doing simple endurance type of exercise may be a bit limited. So I think, I'm sorry, I can't really say what exercise per se, because everybody are individualized, but maybe if we have another session to show what are the basic exercise, maybe that will enlighten her a bit. But I think if there is I'm sure when you have a TLSO, there is a center that may have a physiotherapy on board. They can just go through to see where are the tightness, what are the to correct posture, and that will make a difference.
Okay. So consultation is still, if possible, necessary at least one time in order to assess, and then after that you can actually take up exercises or different techniques and therapies that you can actually do either remotely or through those YouTube videos if it's possible. But I do understand the challenge in getting that, even that first consultation. Doctor, we have a question for you, Dr. Taayah, which is concerning hydrotherapy. What do you think of it? I know you showed a video earlier which has elements of hydrotherapy in it. Is it safe now with COVID-19, and where and how to get good hydro?
Okay, I think that's a good question. But I of course now with COVID situation, unless you have a private pool, but otherwise I think some private hospital will still continue, but with very strict regulation, and also is individualized one-to-one. But basically hydrotherapy, I find, there is no, if you look at studies, there's lots of studies on hydrotherapy for cerebral palsy, stroke, and TBI, but for spinal muscular atrophy, I haven't seen anything but definitely it helps, I feel, because water, children, rarely children doesn't like water. Maybe they're fearful the first, but when they get into water, and the water buoyancy, you can do so much. The gravity elimination, the therapists, what they cannot do on land, they can do in the water. And of course, in the water, usually most of the time we do, in my setup, we do one-to-one, the therapists. And the therapists are trained. I think like in our setup here in clinical, the therapists are trained on the technique of a specific technique. And that will help the parents. And the parents can carry it out in the normal pool. But of course, last time, a lot of parents, they will do it, in their condo pool, they can do of course, the water in hydrotherapy is warm water. But in the normal pool is not normal water. But still, you can do all the exercises in the water. So it is good. I think as long in the hydrotherapy, we have to be a bit careful because it's warm water. So the child, we cannot, they can get fatigued easily. So that's why it's a trained therapist. So they may give, maybe usually half an hour, not so long, to monitor the progress and really build up. But I see the benefit of hydrotherapy in most children, and also in SMA, I still think, but like anything we do, we must monitor, we must know the patient first, assess, and then we can provide the appropriate therapy. And it's not, it can be just happy exercise, swimming. But when we say hydrotherapy in the hospital setup, it is a program, specific program by a well-trained therapist.
I think the key point that you mentioned earlier is the need for recognition that individual patients have individual cases which need to be looked at individually. There's no one-size-fits-all approach to it, right?
That's right.
Yeah. So, Doctor, I'm going to Dr. Egg now. We have a question here. Going back to the BiPAP issue, how long does my child need to be on BiPAP? She is type 1. And a second question, which I'm going to throw in here, is we've been talking a lot about COVID-19 vaccination, and a lot of people are getting vaccinated now. And Recently, the Ministry of Health has indicated that it's considering vaccination for children aged 12 and above. Question is, can SMA children take the vaccine? So 2 questions for you, Dr. Egg. First one is the BiPAP question, and the other one is on the COVID-19 vaccine.
Okay, thanks for the BiPAP questions. It depends on the indication when we use the. If a child with SMA come with an acute chest infection and needing this BiPAP support, when the infection is treated and getting better, he or she may be able to wean off this BiPAP support. But if you're talking about someone SMA with progressive muscle weakness, and the reason the BiPAP being put on is because of hyperventilation. Basically, the muscle is just too weak to breathe, and without not on any treatment, I don't think the muscles will improve. So probably unlikely that we'll be able to take off the BiPAP. For the other question about vaccination, yes, these vaccinations, people have been talking about, well, should children get vaccinated? Even healthy children, should they get vaccinated? What about those with disease and all that? And government has been discussing about this for quite a while. Recently, just 2-3 days ago, we got the guideline on this. This is out on 12 to 17 years old. If follow the government guideline, it is actually stated that it's actually not for all children, not for all 12 to 17, but those with illness, with underlying chronic illness, including neuromuscular disease. The healthy children is, I think it's like 16 to 17. Yeah. So these 2 groups will be the prioritized first when they roll out. In tentatively date to roll out is actually mid of September. So not even this month. This is after all the discussion, review all the data, because the only vaccine that available that enough safety data is actually the Pfizer vaccine for 12 and 17. Of course, there are still ongoing data today, and probably next week we'll probably see different data. But at present, these are the groups that actually encourage to be vaccinated. But if we look at the adult side, those with chronic illnesses, many of them have been vaccinated. There's no data suggestive that those with illness, they got more likely to get side effect or more likely to get any unwanted effect from the vaccination. So I don't think there's any data on that. So generally, even those, generally speaking, for all neuromuscular diseases, it is actually recommended to get vaccinated, because if they get COVID-19 pneumonia, lung infections, the risk of actually getting a severe infection and compromise the breathing probably more likely than the risk of getting severe side effect from the vaccination.
Thank you, Dr. Egg, because I know a lot of parents, caregivers are quite concerned about the vaccine question and how soon can they get their kids vaccinated, and especially now with quite a number of cases that are appearing each day. Thank you so much for helping with that. Dr. Taayah, we have a question here. I'm not sure whether it would go to you or Dr. Egg, but I'm going to pose it to you, which is in terms of the therapy for the muscle and the overall well-being and health for the patient, does it make a difference between having drug therapy, physiotherapy, or no treatment whatsoever?
Okay, I can answer first, maybe Dr. Eng. From my experience, I feel, of course, now with the drug therapy, it makes a lot different. I feel, and the early you give it makes a lot different, because I think for me, 3 important first, the disease modifying drugs that you can, or gene therapy. Then you need a good rehab program, coordinated rehab program, comprehensive, and the dedicated parents, it will be all different. I think by itself, therapy, especially diseases when it's, when they come to us be severe, or the type 1 or type 2, by therapy itself, it may not make so much difference if you don't combine it with the disease modifying treatment. I think that's an interesting thing about SMA for the last few years. I think Dr. Eng pun, I think in your group picture.
Yeah, I agree with Dr. Taayah that first, it's actually very important to have a supportive family, dedicated parents, dedicated to treatment, dedicated to physiotherapies, because these are the things that has to be working in hand. If we just take the therapy, gene therapy, and forget about the chest physiotherapy, limb physiotherapies, the outcome will not be the same. And we do see, I mean, even those we have a few refused gene therapy in our center, we do see improvement in motor functions. So it's definitely the earlier maybe the overseas reports will be data will be better because they really give that early enough. But for ours, because some of them do not get early enough, and it seems like how effective to on the respiratory muscles, all that should probably really need more data, more patients to receive this treatment, then only we probably can comment. Because despite they are on, there are some still get chest infection and still need to be put on machine support. Of course, I think this because the number of the cases are not many, so we can only look at individuals' results. But if we want to see whether this can be generalized to a whole populations, we need those research data, larger populations, when more people, more children get the therapy. But I still have to emphasize this, the chronic care, I mean, the respiratory, the limb care, the physiotherapies, those are the very, very determining factors.
Okay, thank you, Dr. Egg. And so we're coming to the end, and we can have a closing remark from both of you, a closing message. Let me start with Dr. Egg first, and then we go to Dr. Taayah.
All right, maybe first I would like to thank VK Journey and Galen, and thank you all the, organizing members to give me a chance to talk here, and I'm really happy to be able to join in this event. Yeah, that's, I think the whole picture about treating SMA children really need really a group multidisciplinary support. Everyone's doctors, nursing staff, and parents and patients themselves. Everyone needs to get together, come together, and agree on that. Yeah, so then only we can move on to the better, brighter and better future and better outcome. That's what I feel. Because if it's just relies on doctor, it won't work. If it's just patients or parents, they do not get proper advice or proper medical advice, they also may not get the best care that they can. Like, some parents, they may not even know the modifying agents that already available. So make them that do not get the treatment in time. Yeah,
thank you, Dr. Egg.
It's everyone's effort. Thank you so much. Yeah, thank you.
Thank you. Go ahead, Dr. Taayah.
Yeah, I think I echo what Dr. Eng mentioned. I think without doubt, in anyone with SMA, we need to work as a team. There's no way one person can do it. And I think as parents, what I would like to, seek help. Empower yourself with knowledge, learn what is there, and I think don't be scared to ask doctors. I think a lot of parents kadang nak I don't want to ask doctor, but I think you have to persist juga, ask the doctor what is the condition, what is available, and get the right treatment. And always, and I think there'll be challenges, definitely, but I think joining a support group, there's so much you can learn from each other, and you can support each other, and it's different from just getting support from doctors or like Dr. Eng said in the hospital. The support group system and the family, incorporate your family, other family members. I think a lot of parents will sometimes they tend to be within themselves, but sometimes if you don't ask, they may not want to offer. I mean, they may not know what to offer, kan? And of course, I think we work together. I think as a medical, we need to learn, empower ourselves what the latest thing is happening. As therapists, we'll learn all the right technique, work sincerely, and be committed to your patient, and I suppose working together lah.
Okay, Well, thanks a lot,
Sorry, I
Doctor.
left out siblings. Brandon has a very good, excellent brother.
Yes, cheerleader.
Siblings and other family members.
Yeah.
So not just parents. I think
Yes.
friends, probably friends as well.
Yes.
Yeah,
The
everyone.
support
I think
system, right?
everyone
Support system,
around.
yeah.
Yeah. Good.
Well, I think that Dr. Taayah, you made a very important point just now, which is that people should ask if they need help. Ask for that help, and they can get that help because there are people who are able to provide support. So thank you very much, both of you, for your presentations and for your dialogue just now and answering questions. Before we go to our closing remarks from Edmund Lim on behalf of We Care Journey, I just wanted to remind everyone on the upcoming launch of the SMA report, which is happening next weekend on Saturday, 21st of August, 2021. Good news is, don't worry, if you registered for this series of webinars, you're automatically registered for the next one as well, so you don't have to re-register again. So that should be quite straightforward. And please do invite your colleagues and friends for this launch of this important report. So with that, I hand over to my colleague, Edmund, for his closing remarks. Go ahead, Edmund.
Thanks, Azrul. Every time I think back to the early days when my son was diagnosed, those were lonely times and it was difficult times because you're struggling with to find people to talk to. You're struggling to sort of make sense of the medical support situation in Malaysia, and at the time, you can't. There's no one to blame because this is just one of those rare conditions where there's not much known, and where there's am I frozen? Can you hear me?
Yeah.
Oh, because there's not much known, it's just hard to navigate. But if you look at where we are today, it's with the support of Dr. Ek, Dr. Taayah here, and of course all the other doctors that were on the talks before, and who will be on the talks coming up ahead. It's the medical professionals coming together, and what they've been saying today, which is working together with families. Everyone I think plays a role. Sometimes doctors have the best advice and we can't follow through. Honestly, sometimes we're just tired, we're fed up, we're exhausted, and we can't follow through. So everyone I think has that sort of role to play. And beyond the doctors, like they both talked about the family members. Dr. Ek talked about siblings. It's sometimes you think it's just a condition and it's just a family dealing with it, but everyone has some sort of role, and you'd be amazed how much you can play, like including Galen as well, helping us do this, being able to bring the people together to have a conversation. And I think it's about the questions being asked and the conversations that we can have, and we should keep doing that. Because I think it's shown that when we keep doing that, we build greater understanding and we find ways that all of us can sort of work together. It sort of sounds like, whoa, but for someone who's been in the journey for 10, 11 years, I can talk on and on about how this has changed and how it sort of really impacts our life. And I'm glad that we have been given the opportunity to play a small role, but that role only drives the impact because of everyone here today, and includes the audience, right? And I think that's something that it's easy to overlook, which is the people participating today and asking questions and being curious and trying to find out more. You guys and girls, sort of, and ladies, gents, everyone gives us, the encouragement to work through this. SMA is so multidisciplinary. You talk, there's so many doctors, so many therapists to talk to, but as more of that comes together, the more we can see the light, and the more we can really hang on to the hope that we can really do better. So thanks a lot. I just don't know how to express the thanks for everyone here today.
Thank you, Edmund. Thank you so much. Thank you to all of you for attending this morning's webinar. I just want to remind that we have a feedback form that you can just scan. Everybody has a QR code these days, so you can just QR code that and do send that feedback form to get your e-certificate. And please do join us for the next session, which is the launch of the SMA report next week. And with that, I'm Azrul Khalib from the Galen Center for Health and Social Policy, signing off. Thank you very much for attending today's webinar on spinal muscular atrophy, stepping up for SMA. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Stay safe.
Thank you.
Bye.
Thank you. Bye.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thanks.